must have wondered how our own well-being is tied to the health of the animals we share this planet with and to the ecosystem that sustains us all. Today's talk will be on the interconnected well-being of people, animals, and our planet, delivered by Dr. Kikiope Oluwarore, the founder and executive director of the One Health and Development Initiative. OHDI is an organization dedicated to promoting and fostering One Health education, collaboration, advocacy, research, and interventions across human, animal, and ecosystem health. Dr. Kikiope is a veterinarian and One Health expert whose work advances global health security, sustainable food systems, animal welfare, and climate resilience. At OHDI, she leads the development of Rore, an AI-powered multilingual tool for assessing health information, services, and referrals across One Health domains, as well as the AfriWell program, a Pan-African initiative promoting ethical and sustainable aquaculture. She also heads global programs on antimicrobial resistance, climate health intersections, and One Health movement building. She has consulted for organizations such as the World Health Organization, International Federation of Red Cross, African Union, International Center for AMR Solutions, Chrono Sustainability, Animal Advocacy Africa, and Animal Advocacy Career, among others. She is passionate about equity, inclusion, and leveraging technology for impact, and thus works to empower underserved communities and promote ethical, innovative, and interdisciplinary approaches to health, animal welfare, ecosystem resilience, and sustainable development. In this session, Dr. Kikiope will shed light on the concept of One Health and explore how we can integrate it into our efforts to doing the most good. So this session will include a Q&A after the talk. So please send your questions through Swapcard. Just open the session on the app and click the speech bubble to submit your questions. Distinguished guests, please join me in welcoming Dr. Kikiope Oluwarore. You can do better than that.
Good morning, everyone. And I'm really glad to be here and happy to have everyone here on board. I also am very happy to see the growth of the EA movement in Nigeria, which has culminated to what we have with the EAGxNigeria today, and also a very big well done to the organizers. So I was going to do a bit of introduction of myself, but I'm glad that Basit has done most of that. And I'm here to talk about a topic that I'm very well, it's the core of what I do as a public health professional, as a veterinarian, as a One Health professional, and it's talking about the interconnected well-being of people, animals, and our planet. And a lot of this is hinged upon what we call the One Health approach, and we'll be exploring how we can implement what I'm going to talk about when I explain the One Health approach for effective altruism. Okay, so my outline is I'm going to be off camera. I'm going to be providing information on definition and evolution of One Health, operationalizing One Health as a system thinking model, applications and impact of One Health generally, and then we will zero in on into how we can integrate One Health into our work or our identity as effective altruists. And then lastly, we would have a couple of reflections and call to action. So first of all, we'll talk about One Health, the evolution as to what it has become today, how it even started, a brief of how it started. I won't go into much details, but exactly how it has evolved over time and what exactly it means. Maybe first of all, is there anybody here who has heard about the concept of One Health before? Just a show of hands. One Health. Okay, so most of us have not heard. Okay. I think it's something that has been much more talked about in terms of those who are in global health and sustainable development sustainable development areas of work. So I'm going to start with a couple of pictures to give us some kind of imagery or a mental picture building up onto what I'll be discussing. Here we have a picture of a doctor attending to a patient, a veterinarian attending to his patient too, and that's a dog. And then a farmer doing his work, on gathering things for crops and all of that. And then we have also another farm. This is focused on livestock farming. You can see here sheep, goat. Okay, maybe not goats in the picture, but cows, cattle. We have a picture of food from animal sourced and both plant sourced in the supermarket, as the case may be. We have drugs, medicines, antimicrobials, antivirals that people are using to solve or to treat different diseases. We have in the picture on the far down right here of a very polluted environment. People are wearing nose masks. There's a lot of, it looks very, uncomfortable to even look at. There's a lot of waste outside there. There's also a bit of a fog, pollution going on. And then you also have here flooding, which is something that we have been, it's an increasingly occurring event now across the world. And then we have a wildlife ecosystem. We can see, for example, zebra, elephants, and of course the land ecosystem. And then we have what I would consider as a marine ecosystem. And this is basically creating a picture. I'm just creating a picture for now. We'll talk about what this picture means as we proceed. Now, we have 4 boxes: human health, animal health, agriculture, plants, agriculture, plant health, agriculture, and then environment. What we have here is that, in the beginning of time when, the field of health and medicine started to evolve, we have seen that people in human health do their work as medical doctors, as nurses, as physiotherapists. Everybody's really doing their work very well. Sorry, I need to remove my glasses. The glare is affecting my eyes. Because I can't see everyone very good, but I think I'm better off with this. So what we see is that what we have been seeing over time as the world, has grown so far is that the human health sector has evolved. And everybody is doing their job as focused on their primary duties, what they have gone to school to go and study. If you're studying, if you're studying medicine, you're working as a medical doctor. You're working in hospitals. You're just focusing what you know how to do best. Same with people who have worked in the animal health sector, like the veterinarians, the farm handlers, and all of that. And the same also with the crop farmers who have worked in, who are either agronomists or even just the basic farmer who is ensuring that we have food on our table. And then we also have those who are also working in the environmental sector. Now, what we have seen is that while we are all doing our own specialist work, all of us have our roles to play. We are doing very great with advancing our respective fields. We have realized that a lot of this work has always been in silos, which is fine. But now, many of the current global health challenges that we have been having have actually things that are now affecting each other's sectors. So, for example, we have the case of zoonotic diseases. These are diseases that spread from animals to humans. We have seen that there is an increasing number of these diseases across the world. Currently, according to statistics by WHO, 70% of all emerging diseases that we have in the world currently are all from animals. A huge 70%. That's a lot. And then we're having cases like food safety, food security, in which case they are having interconnectedness from, food safety issues that is probably from the food we eat, whether it's plant-based food or animal-sourced food. It can be contamination from bacteria, which can be from animals or from the soil, and then they are affecting us as humans. We are having issues like antimicrobial resistance that are coming from, let's say, the drugs that we are using to feed our animals or what we are using for our plants. And when we consume them, we are having residues of those foods even in our own system, and it's causing different kinds of health issues. It ranges from diseases to cancerous cancer and all of that. So we are saying that the world is not just about what we are doing alone. The world has gone to a place where we have to understand our role as what we are doing, how is it affecting other sectors, how is our work interconnected, how are global health issues that are coming up across the world actually are drawing from a source that is not necessarily our own field, but is affecting our own field and is causing the kind of vicious cycle of diseases, vicious cycle of environmental health issues, vicious cycle of climate change issues, vicious cycle of dwindling biodiversity, and a lot of interconnectedness across that part. And which is why we have come to a point where we call the One Health. One Health basically recognizes the fact that the human health, animal health, plant health, and our ecosystems are all interconnected. And if you're going to address sustainably, I put the word sustainably, I emphasize on that. If you're going to address health and development issues sustainably, we must be able to take all of this context take all of these issues into context and be able to address our health and development challenges in a holistic way. We must recognize that my work as a vet or your work as a doctor is not just for your work in human health alone. But if we have failures in the human health sector, it's going to impact the animal health sector and other sectors involved. If we have failures in the animal health sector, we're actually having issues. We're actually going to have issues as humans also. If we are not dealing with our environmental health issues as much as possible, it's going to have a flow-through impact on other sectors that are not necessarily our primary sector. And so we must recognize our roles in this space. So very quickly, I'll also go through a couple of additional pictures. Now, One Health started as just this simple framework. We can see the human, animal, environmental health, and the One Health in the middle, showing that central interconnectedness. And then over time, we started seeing that people started talking about healthy humans, healthy animals, safer environment, and that's the ideal that we should have. And then later, we started having contexts coming out. What exactly are the One Health issues? What are the sources of One Health issues? What are the impacts of One Health issues? We have things like, it doesn't have a pointer, but we can see things like diet, food security, antibiotics and other antimicrobials, intensive livestock farming, disease vectors, biodiversity loss, deforestation, air pollution, water pollution, climate change, population movements, and again, social determinants of health. All of these things are things that are very, very much interconnected. Food safety is not just a human health issue alone. It's an animal health issue. It's an environmental health issue. Antimicrobials is not just antimicrobial resistance. I mean, that's maybe we can discuss that, but it's something that is a very, very, it has become a public health emergency. Because now the drugs that we're using now are not working for us anymore, because the diseases are evolving, the microorganisms are evolving so much that they are now resistant to many organisms, the drugs that we have been using that used to work for us. So for example, things like penicillin, tetracycline that used to work well for us back in the day, it was very cheap, it was effective, but many people are now resistant to tetracycline or penicillin because the microorganisms have evolved, and then they are not treating disease like they used to before. So imagine somebody goes to a hospital for a wound infection, and because he is resistant to antimicrobials, you cannot treat even a simple wound infection, and the person dies because of that. These are things that are actually happening in the world right now. And it is a One Health issue because it comes from the fact that we are not using our drugs well. The food we are eating have been pumped with antimicrobials, and we are consuming them, and they are causing resistance for us also. We are looking at things like disease vectors, but all of these things that are here, they are all very, very strong reasons to consider the integration of the One Health approach. And another one here is, this one breaks it down. It talks about humans, plants, animals, environment. I think I'll just quickly skip because of time. And here, this one from One Health Sweden is a picture that I got from One Health Sweden, and it brings out different disciplines in terms of, as a professional in your field, whether it's environmental health, ecology, veterinary medicine, public health, human medicine, and many of those things, it's kind of provides an overarching representation of what your role is as a professional and how it aligns with the One Health approach. And I think we should start thinking of this in terms of even our role as effective altruists, which I'll come to later. And then this one is by the US CDC. And this one brings in the active part of One Health. What exactly, now we understand what the One Health is about. I mean, I assume based on what I've said, we probably have some idea of what One Health is. But what exactly does it mean in terms of how we coordinate, how we work with each other? And there's the concept of ensuring that we are able to coordinate between ourselves. For example, in my work as I studied veterinary medicine, and of course I'm in the public health, One Health space. But in the course of my work, I've probably interacted with more people outside of my veterinary work than in my veterinary space. I work with people in ministries of health, ministries of environment, ministries of agric, I mean the crop part of agriculture, even Ministry of Finance. I work with people across different sectors because that coordination, communication, and collaboration is one of the ways by which One Health is really implemented. So this brings this out very well. And lastly, this graphic here is from the One Health High-Level Expert Panel established by FAO, WHO, UNEP, and WOA. It's the agencies for human health, animal health, and environmental health primarily. And this provides one of the best examples of what One Health is today. Of course, it mentions the fact that healthy animals, healthy humans, healthy ecosystems represent One Health. But if you check to the left, hopefully it's your left also, yeah, you would see that it also talks about the different sectors and disciplines, that need for collaboration between human health professionals, animal health professionals, environmental professionals, and even other professionals that are not even mentioned here. And then to the right, it talks about the whole of society approach, ensuring that whether it is at the local level within your own community, or at the subnational level within the states, or at the national, or at the regional, or at the global, at every level, One Health can and should be implemented. So it brings that systems thinking part of things into fore. And this is exactly how, at the end of the day, we're able to have better coordination systems for implementing One Health, whether it is within your own field as an individual, or if you're working with others at higher levels. Okay, so after saying all of this, what exactly is the balanced definition of what One Health is? And I'll bring two definitions from US CDC and WHO because I think they are the most encompassing so far. One Health is a collaborative, multi-sectoral, and transdisciplinary approach working at the local, regional, national, and global levels with the goal of achieving health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. It recognizes the fact that the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent. And the approach mobilizes sectors, disciplines, and communities at various levels to work together to foster well-being and to tackle threats to health and ecosystems while addressing the collective need for clean water, energy, all the things that we love to have that are considered good for our lives, and contributing sustainable development. And this kind of brings everything to fore. So those pictures I shared initially, we can see the interconnection. Everything is literally connected. If you're working in the area of global health and development, for the most part, if you're working, whether you're working with women, with young people, with children, in the human health, animal health, environmental health, plants, agriculture, whether you're even working as a tech person, you have your role to play. Whether you're working even as an economist, health economist, you have a role to play. There is always a line in which you're able to think, okay, I am doing this work and I'm doing it well, but how am I impacting the larger part of my work or the society? And these are questions. So this is just a few examples of the kind of alignments with One Health, but it is much more than this because I can't put everything on this slide at once. Now, operationalizing One Health as a systems thinking model. And I'll use this to build upon what our work is with effective altruism. If you want to be able to work or align your work with the One Health approach. You need to be able to know that, again, based on what I've said in previous explanations, it's not just about you. It's about recognizing what exactly are you doing that is able to align or contribute to the overall development, health, and sustainable development of your community or your country or wherever, at whatever level you're working. So one of the things you can do, first of all, I will give an example. If, for example, you are working in the area of food safety and you want to be able to align the One Health approach to it, you think of what exactly, of course, you know what food safety is, safety of food to ensure that we're not falling ill and all that. You define your stakeholders and your boundaries. Who are the people involved in? What exactly is even food safety? We have food from animals, we have food from plants. Who are the stakeholders involved in the kind of work that you do? You think of people like, if you're looking at plants, if you're specifying on plant-based foods, for example, or animal source food, you think of what area in that plant. Let me give an example of, let's say, animal source food. So, for example, I am a vet. I'm thinking of the work of the area of food safety. I'm thinking of abattoirs. For those of us that are in Nigeria, we know how terrible and how, maybe we will not know, but from the first time I entered an abattoir when I was a veterinary student, and that was like 2009 or so, long time, well, I don't know whether it's long for me, but a long time ago for me. From that year, I have stopped eating beef, literally. Because when I entered that place, I saw what was going on. I said, no, I'm not going to be doing this. And this was long before Effective was doing whatever. This was just like, I'm not going to be eating something like this. So if you go to the abattoir, you can understand, you would appreciate very much the essence of things like food safety and animal welfare. You will see how animals are treated. You will see how unsafe the environment is, even for those who are even slaughtering animals. You will hear stories about diseases that they get from those animals that they're slaughtering, things like TB, things like brucellosis. You will appreciate many of the things that really, really needs the One Health approach. So going back to this particular one, define your stakeholders. You think of abattoirs, you think of those that are selling meat in the market. You think of the medical personnel that are also working on food safety issues. And then you would map interdependencies. Like what I said, how is what I'm doing, let's say as somebody who is a vet, affecting things like meat inspection? Am I doing my work well as a meat inspector? I'm seeing worms, for example, in meat, and I'm supposed to condemn them. Am I condemning meat? I'm seeing butchers selling infected meat to the populations. Am I doing anything to do my work as a good meat inspector? I'm seeing unsafe environments. What am I doing to address things like waste pollution in abattoirs? Where are they disposing their waste? Some of these waste can be disposed, for example, in nearby rivers. How is it affecting the spread of antimicrobials, the spread of diseases? Do we understand the interconnection I'm talking about now? Like just something as simple as just an abattoir. I'm already bringing out like different issues affecting humans, affecting the animals, affecting the environment, and we are seeing those interconnectedness and dependencies. And then we will as effective, this is very important to us as effective altruists. We need to use data, evidence for decision making. It's not just, I heard, I saw, I did. You can document things down. You can do maybe a small study on this. You can be able to do something that will provide evidence that you can use for, say, advocacy, or you can use to pilot an intervention or a project. Because you have seen an issue. You have seen that the issue is a One Health issue. You have seen that the issue is something that has far-reaching impact on not just human populations, but also our environment. And you can be able to do something to use whatever data you have. Even pictures is data. I hope we know that. Pictures, videos. Now we have social media. You see issues that are on ground and you're like, I want to share information. I want to promote advocacy on this. For me, what I did, giving an example of what I did was that when I did some work in the abattoir at that time, I actually wrote a paper on the cable at the time. That's kind of, it sort of made a lot of, would I say, I don't know whether it was viral at the time, but it's because there were pictures that were shown. There was a proper documentation that was, okay, this is what we saw in the abattoir, and this is what the government was doing. And what happened that time was that, of course, there were kind of some threats, because some threats, people were calling me and asking, who am I to write such paper, blah, blah, blah. But we saw that action was taken because the government at the time, Governor Ajimobi, God rest his soul, actually took action that time when the paper on the cable at that time went viral. And then he took action to relocate to, do some, he called a meeting and everything, and then he took action to finish up the new abattoir that they were building, and then relocate them from where they were to another more sane environment at the time. So these are examples actually of you using the One Health approach to be able to drive home a point, implement solutions, implement interventions. It doesn't have to, it can be something as simple like what I said, taking pictures, writing, taking evidence and making decisions on how interventions can be done. And then co-design interventions. So I didn't do this alone. When I did my work, I did this with, I did this in collaboration with stakeholders, both within the abattoirs and outside the abattoirs. People who are just interested. Okay, example, I use the media. I'm not a media person, but I know how to write. But of course, I got in contact with the media, like, okay, I want to have a story that I want to tell, and I think it's important for action to be taken on this particular abattoir. And then with that collaboration, we're able to design this kind of interventions, which was able to perform some good outcomes at the end. So now, another example of the systems approach to One Health is what they call the One Health Joint Plan of Action. And this, again, was established by the quadripartite, like I said, the WHO, UNEP, FAO, WOA, and WHO, WOA, UNEP, and FAO. And they have taught, because One Health is also being implemented at that level, they have taught, okay, how can we be able to build a health system strengthening framework that One Health can be applied across board. So they've talked about the fact that One Health can be able to strengthen health systems. That's action track 1. One Health can be able to help reduce the risks from epidemics and pandemics, particularly those that are zoonotic. One Health can help to eliminate neglected tropical diseases. One Health can help to improve food safety systems. You can see there. One Health can curb antimicrobial resistance and integrating environment into the One Health. So they have a systems approach to it that they've mapped out all the different areas that One Health is aligned with according to what is within those 4 organizational systems. They've even done an MOU on working together, and they've seen, okay, this is how we want to be able to address One Health threats over the next maybe couple of decades to see that we can have improved public health and sustainable development. And this plan of action, you can read it up, it's online, is in implementation today. This was established about 2 years ago, and it's currently being implemented. So now, what exactly are the applications of One Health? How has it impacted the world so far since its introduction a decade to 2 decades ago? Number 1, One Health has helped to address epidemics, pandemics, and biosecurity. For those of us who are interested in areas around epidemics, global health security, whether you're a laboratory scientist or you're a doctor or you're a nurse or whatever field you're in, these are things that you can be able to align with One Health. So in Nigeria, for example, and many other LMICs, where we have a lot of disease epidemics year in, year out, they have employed the One Health approach. Things like Lassa fever, Mpox, avian influenza, COVID-19, Ebola disease, Marburg disease. These are things that we see a lot in African countries particularly. And even rabies, schistosomiasis, those are NTDs. We have seen government institutions work together. In ministries of health, ministries of agri, ministry of environment, they've gone together to do responses. They've gone together to treat patients. Those who are treating humans will treat animals. Those who are treating animals will treat animals. Those who are addressing the environmental health determinants of health will do their own work. But at the end of the day, they are working together. They are responding together. They are preventing, diseases together. They are working together to establish certain action plans that are protecting the populations. Many things go on underneath at those levels or at the government levels to ensure that we have the safety of human beings and animals and environment. And this is part of what we are doing. And then One Health is helping to also strengthen the work of health workforce. Health is used broadly. It doesn't have to be human health, it can be across all the domains of health. So we are having programs such as awareness, capacity building, and collaboration across board. We are having trainings that used to be just for, let's say, just the medical people or the veterinary people, but they are now working together. Please, I want to know how much time I have left so I don't go beyond time. Thank you. So they are all working, 10 minutes, okay. They are all working together. And then we also have AMR control. We are having human and animal health professionals and even environmental health working together to ensure that people are using antimicrobials responsibly in both for yourself and also both for humans and also both for animals. They are establishing legal frameworks to ensure that we are not there is controlled access to certain drugs or antimicrobials. People cannot just go to pharmacies without a prescription for certain antimicrobials and all of that, or for antimicrobials generally. And again, I'll just quickly run through this. We have also seen the impact of One Health on things like surveillance of diseases. For those who are using data, who work a lot with data and technology, this is something that is very important. For these three things in terms of surveillance, resource, and political commitment, I have actually, been a part of certain mechanisms where we have been able to build surveillance platform from just Excel sheets. We used to report data through just having Excel sheets sent through email, and now actually having data technology built to be able to actually share data, report data, analyze data, and visualize data that can be used for evidence. We need evidence, okay. We need One Health has made this possible, because without One Health, we would not have even had people, report diseases from, let's say there's a rabies outbreak. They're like, if there's a rabies outbreak, for example, we can now have human health say, there is a rabies outbreak in so local government, and then the animal health sector says, there is actually a rabies outbreak also in dogs in this area, and then they can work together to be able to address such issues. So these are kind of things that One Health has done. Okay, so moving to the very last part, applying One Health in EAGxNigeria areas. I'm going to just talk about just a few EAGxNigeria areas and just discuss around how you can apply One Health in these areas if you work around them. Number one is global health and development. I mean, this is quite direct. If you're working in the field of global health development, and you want to integrate One Health into your work, frame it as a preventive solution in terms of pandemic prevention, AMR, climate, and health. Use EA-aligned metrics such as dailies, cost per life saved, ROI on vaccination. Maybe those who work on global health and development will understand what I'm saying here. Then showcase traction through pilot projects, and also foster collaboration between EA and non-EA organizations. This is something that I think we should do more. If you're doing anything around what I said, I think there needs to be better collaboration, because many non-EA organizations are doing quite a lot of things, and we can have learning across sectors. We can learn from them, they can learn from us. We can learn we can learn from them in terms of these are people that have been doing this work for centuries, if not, for a long time. And then they can also learn from the EA sector in terms of cost effectiveness, in terms of evidence, using evidence. And those are the things that we EAs have very strong alignment with. And there can be that cross-sectoral, information sharing that can be done across board. And then for those working in animal welfare, something that is also very, very, very dear to me. You need to frame One Health as a One Health issue. I see many people across board working on animal welfare, doing things around, establishing intervention and project in the field of animal welfare. It's very commendable. But you also know the world that we live in. We live in an LMIC. We live in countries that they are probably thinking more about what to eat, or where to get food, or where to even get money to feed, or where to live, and things like that. So we need to let people understand that apart from the area of compassion, that we need to also, the compassion that we feel for animals, we also need to frame us as One Health issue, in the sense that it's also a human health issue. It's also a climate change issue. If we don't address the welfare of animals, whether the issue of intensive livestock farming, we are degrading our environment also.
we are affecting our food systems. We are not making our food safe for us to eat. So it's also a key thing. We should also focus on neglected animal population, which many of us are already doing. Farm animals are neglected, working animals, stray animals are neglected. Again, demonstrate fraction and use metrics. Again, back to the part of cost effectiveness. Talk about number of animals reached, the suffering reduced, and all of that. And then if you work in climate change, support climate health-related surveillance systems. Promote climate smart agriculture. This for me is the most important. This is very lacking. This is it's a big issue in many LMICs. Climate smart agriculture, climate smart ethical agriculture, very, very important. We need to ensure that we are aligning with this, and this is an application of whatever we do with our effective altruism work, and also aligning with the One Health framework. We also need to integrate One Health into climate adaptation plans and highlight the impact of climate change on animals. Then if you work in global catastrophic risk or long-termism, we know that when you're talking about GCRs and long-termism, we are talking of things around diseases, around nuclear risk, around technology risk, and many of all those things. You should frame One Health because of the more sectoral nature of GCR and long-termism. Frame One Health as an important infrastructure for long-termism. Also develop LMIC-led long-termism interventions. Many long-termism and GCR interventions that we have currently in the world are still very much westernized, and I say this without apologies. We need to think of LMIC and locally relevant long-termism interventions that we know that are relevant to our sector as where we live, where we stay, how exactly it impacts us as effective altruists and even our communities, and be able to utilize our local knowledge to implement these interventions. And then apply tools like AI. There are quite a lot of AI experts around us, but please, we need people like you to be able to support things around long-termism and GCRs. And build resilient cross-sector systems. I'll just move very quickly. Poverty elevation, a very important EA cost area. We need to target livelihoods that are built on climate and health resilience ecosystems, prevent health shocks that trap people in poverty, support women, young people, and marginalized populations, and then promote digital tools for health and financial empowerment. Poverty elevation is from sectoral. It's from health, it's from livelihoods, it's from environmental and climatic issues. And we need to be able to address all these things using this One Health approach. And then AI governance. Our people in AI, please, let's listen very carefully. For people who work in AI, based on our work as AI, we can start, again, I'm talking locally now, thinking, because we're in an LMIC setting right now. We need to include safeguards and guidelines on the use of AI for humans, the impact on non-human animals, and also on the environment. Then we need to promote equitable access and capacity in LMIC. We don't have that currently in the AI sector. Governance structures, AI applications, AI tools, AI interventions, we don't have many of them. We need more of this. We need to see how we can be able to use these tools to improve our systems, to improve our entire ecosystem in terms of health and development in an LMIC like we are now, and promote equitable access and capacity. Train people, improve their capacity to implement AI tools, and then support the development of open, responsible One Health AI tools that can be applied across the One Health movement, across the One Health sectors. We are looking for more like that. We have one organization which we are currently using, but of course we need more of that, and we're looking to collaborate with more people on that. And then educate AI developers on One Health. If we need education on One Health, please feel free to reach out to me, or we need people like you to work in the One Health sector. And then reflections and call to action. This is for you. As an effective altruist, what role does One Health play in my work? Where does my cause area intersect with One Health components? How can I effectively apply the One Health approach for effective, impactful, and scalable interventions? How would applying the One Health lens change my cost effectiveness analysis or prioritization models? Which high-impact interventions will I strengthen by integrating One Health? How can I support scalable and data-driven One Health solutions, e.g. AI tools, this is surveillance, ecosystem monitoring, and so on and so forth? How do I ensure that my actions promote equity and prevent or mitigate power imbalances between human and non-human stakeholders? And then lastly, what does a long-term future look like if we fail to integrate One Health into our global systems? These are questions we should ask ourselves as viticulturists, and to be able to understand your role better in your work as an individual, your identity as an effective altruist, and also your work in being able to apply the One Health approach to your work. And then lastly, I'll just leave you with this. If you truly care about maximizing impact, particularly across human, animal, and ecosystem well-being, then One Health is your system's lens for doing the most work. Use it, apply it, and please share the results of the work to do and the wonderful work you're doing. Thank you very much for listening.
Thank you so much. Please put your hands together again. Thank you so much, Dr. for that side. Our time is fast spent. So with that, the Kikiope will be having an office hour by 10:30 a.m. That's right now at Hall 2 at the exclusive hall. You can meet her there to answer any questions you have. And you can kindly check your swap card for what's next on the agenda for those who have other things planned on the agenda. Thank you so much.